As you've just seen there, healthcare workers in KwaZulu-Natal becoming the first in the province to receive the Johnson & Johnson COVID-19 vaccine. The provincial government has meanwhile outlined its plan to vaccinate the rest of the population. There is an estimated 11.3 million people living in the province, and the local government hopes to reach the majority of its citizens based on guidelines set by the World Health Organization and the National Department of Health. Professor Mosa Moshabela joins us now. He's Acting Deputy Vice-Chancellor for Research and Innovation at the University of KwaZulu-Natal. A very good evening to you, Professor Moshabela, and thank you so much for speaking to us. So just what you've seen so far, the rollout and the government's plans to achieve herd immunity, what are your thoughts around this?
Greetings, Tsepiso and your viewers. I think it's actually been a long year. Now, just as I'm listening, watching these clips now, I just went back to where we came from, and I really think that it's been a long journey. And I am hopeful that with the spirit of working together that we currently have, we're going to go a long way. I think to achieve herd immunity is going to take a lot, especially because at the moment, we have to work closely between the public sector and the private sector. And that's really going to take a lot of effort to ensure that is achieved. I'm hoping that this phase that we are in now, in the phase 1, can help us also achieve a good foundation. If we can get that foundation strong enough, then we will be able to get the healthcare workers in both public and private to help support the drive to vaccinate the rest of the population.
What do you see as central to that foundation? The provincial government saying, for instance, that they're going to set up provincial command councils, and they've also set up various objectives, including data capturing and also looking at resource allocation, patient flow, etc. What has been missing so far, especially in terms of data capturing? I know we get daily reports from the National Health Department, and that flows from province to district. But what has been missing, do you think?
I actually think that in terms of data, when we look at the past year, government and the private sector have been able to build a successful system for testing and coordinating the numbers for testing from both public and private. I think that they have a foundation for data that can be used. And also because in the country, generally, there's an effort to try and centralize data from different streams. So I feel like we have come a long way there. It's going to take a lot of effort to make sure that it's done properly. What I find is missing a lot is the actual readiness of the people who are going to receive the vaccine. I don't know that we have done enough to make sure that people know how they're going to get a vaccine and where. So, for example, now we've got a few vaccines, but we're only using 2 sites. That can limit access a lot to a lot of people. In a vast province like KwaZulu-Natal with a lot of rural areas, we cannot necessarily think we'll distribute vaccines through the normal vaccination points that we have in health facilities. So we have to think creatively. That's where I feel like we're looking only at the supply side of things. We're not necessarily looking at the people who are going to receive it and think about what is it that they need to get to a point where we can vaccinate all through this foundation that needs to be built. If the foundation is not built with that perspective, the people-centered or user-centered perspective, then we are going to fall short.
I mean, the Premier himself says they're doing their best, that they are, as he says, at the mercy of manufacturers. I think that is a reality. But just currently, the vaccine rollout, as you say, there is a limit of vaccination sites. But the pool of people that have been chosen, obviously it has to be the frontline workers. But it's very interesting that they are looking at NGOs, those in the military, healthcare sector, environmental health practitioners, including traditional healers. Will this help, especially with the information drive? As you say, there's not enough known of who should be vaccinated, or the people who will be getting vaccinated, they don't have enough information.
Yeah, well, I think what's happening now is that when you go for vaccination, you get pretty much enough information you need about the vaccine, especially the way it's being done now, where they have to obtain your consent. And I feel like it is a good opportunity for that one-to-one engagement. And my hope is that the more people who are going to vaccinate, the healthcare workers, are exposed to that and feel confident, they can actually be able to translate that confidence to people that they will be engaging with. I just worry that for herd immunity, the vast scale that is needed is going to be too large for us to be able to cope if we are using the healthcare system as we know it. I for one, think that I'm seeing globally that there's a bit of a shift. People are emphasizing less herd immunity. They're emphasizing more of preventing severe disease and death and hospitalization. It's almost like we are leaning more towards prioritizing people with risk factors before we think about herd immunity. It's not a bad approach, but I do think that it might actually end up being the direction that we take. And if we do take that approach, then we need to communicate that very clearly, because otherwise there's going to be a lot of discontent with a lot of other people who are ready to take the vaccine.
Thank you so much for your time. It's unfortunate we have run out of it, but thank you very much, Professor Mosa Moshabela, Acting Deputy Vice-Chancellor for Research and Innovation at the University of KwaZulu-Natal.